Now to the latest on COVID-19. More than 17,000 Arizonans have lost their battle with this virus. And all new at 6, we're getting a never-before-seen look at how the state leaders responded to this pandemic.
Governor Doug Ducey has long said he has been following the science. Now, ABC 15 has obtained weeks' worth of public records illustrating just what he and other state leaders were being told and what wasn't being communicated to you.
Officials met nearly every week with some of Arizona's top researchers and health experts. There's not many documents to show what they advised, but our Nicole Grigg has spent all day sorting through what we do have.
And she's going in depth for you tonight in what they reveal on the pandemic response.
We want to be very clear that we made these public records requests back in November when time was of the essence because cases were spiking. But now we're able to look at what was being said internally and what was being said publicly by state leaders. ABC 15 is finally getting access to records of weeks worth of internal meetings between the Department of Health Services and the modeling team made up of researchers from ASU and U of A.
The other thing that we need to do as we go through this is to protect the healthcare system at all costs.
That's Tim Lant, one of the top researchers on that team. This was back in April, where he gave a presentation to the Phoenix City Council. That same time frame, he spoke with Senator Kyrsten Sinema's office. Then days later, that modeling team was quietly fired.
An ADHS official emailed the team, telling them to pause all current work on projections modeling.
After our reporting of the firing, the state reinstated that modeling team. And now, nearly 5 months after our request, we are finally seeing internal documents that show how ADHS worked with that same modeling team. And while health officials were getting advice on disease spread and statistics, their public face did not reflect what those experts were saying. Back in March of 2020 was the very first meeting. There was an agenda followed by notes from that meeting, but after the first two, those notes and agendas stopped. The modeling team met with ADHS officials nearly every week for an entire year. ABC 15 asked for all those documents, but we only received about a dozen of them. State officials say notes, minutes, and agendas were not taken, but they were able to provide us some of the notes from some of those participants. Those notes stop in August, and we have been told by a member of that modeling team that Dr. Kara Christ was not a part of them, so it's unclear what she was told.
It's obviously being passed along second, third hand to Dr. Christ. So it's important that you be present for those conversations, number one. Number two, if you have other questions, then you need to gain clarification from those modelers.
The state's former director of emergency management, Wendy Smith-Reeves, says she's surprised there are not more documents in our public records request and says that this modeling team is important.
It's not just the ADHS team that you should be listening to. It is all of these teams. We need to have that diversity in dialogue and perspective and then find out where the nexus point is, and that's the direction that you go.
But in the batch of public records we did get, we're hearing for the first time about how there were concerns brought up about those who were unemployed and that would end up on the state-funded health insurance known as Access. In other words, the state would have to pay. Back in May, a state employee wrote how the groups talked about unemployment figures too. We talked more extensively about the lag between unemployment, loss of health care coverage, and access to health care, and a rise in applications for public insurance. Then again, this time in June, concerns were made about the economic impact on the healthcare system in Arizona. Quote, "We seem to be headed into a time where increasing lack of health coverage and increasing hospitalizations may converge into a serious problem."
Everything that we talk to you about today will be informed by data and information.
And then in June, when the governor was promising to give the facts, the messaging behind the scenes and the messaging to the public was different. On June 11th, state health officials met with the modeling team hours before the governor had a press conference.
Good afternoon.
The notes from that behind-the-scenes meeting say Arizona is on a trajectory to reach virtual limits on hospital ICU capacity in 10 days. But the governor made it clear in that press conference the same day, we have capacity.
We have capacity in our ICU facilities in Arizona regardless of what you are extremely sick with.
That June 11th meeting was nearly a month after the governor lifted his stay-at-home order. It shows how health officials were told that the infection activity around this time was from 10 days to 2 weeks in the past. The notes make clear, so whatever happens in the next 10 days, the die has already been cast and nothing we do now could modify it. Cases would continue to go up in this time frame, and it would take 18 days after these conversations before the governor would shut down bars, gyms, and tubing on June 29th.
My dad started to feel symptoms the last week in June.
That same time frame is when Tara Krem's father got sick with COVID-19. He died in what would become known as the summer surge.
There were so many behind the scenes people advising our governor and our elected leadership that we needed to do more to protect our communities.
Arizona has hit 17,000 deaths, and our state leaders have not acknowledged if any deaths could have been prevented. But back in January, we did speak with one of those top modeling researchers who sat in on those internal meetings, and we asked him if more could have been done.
There's no question that many Arizonans were infected and died. Those infections deaths could have been prevented.
As for why are there only a dozen of these meetings when these teams met nearly every single week, a spokesperson for the Department of Health Services says the weekly calls are informal and open for discussion. They also say the state has its own public health experts and medical experts like Dr. Kara Christ. Reporting in Phoenix, Nicole Grigg, ABC 15, Arizona.